Assalamu alaikum viewers, this is Dr. Khawaja Sajid. I'm one of the orthopedic surgeon. Today the public awareness program which we are going to discuss about is age and total knee replacement. Many of patients, many of attendants, they asked one of the questions is my mother is fit for surgery because she is 70 years old or she is 80 years old? So it's one of the common question which attendants or patient they ask. Oh yeah, she is old enough to go for any surgery. And how old is she? Oh, she is 60. So I realized that we shall conduct one of the program to discuss this issue as well, because many people, they don't know or they have a lot of queries about that, if this is the age limit, or is there any age limit for any total knee or total hip replacement surgery. In conclusion, I would say no. Generally speaking, no. There is no age limit for total knee or total hip replacement. Now I discuss why there is no age limit. First of all, we do the total knee or total hip replacement or joint replacement surgery is a lot of reasons behind that. You just don't go for every patient. Is an indication for certain diseases, certain patients. Initially, when this joint replacement was started, it was because of inflammatory arthritis, rheumatoid arthritis. That was the first thing when this joint replacement, especially knee and hip replacement, started. Later on, it took over about the osteoarthritis and post-traumatic and other reasons. Rheumatoid arthritis, inflammatory arthritis, usually is a congenital disease. By the age of 20 or 25, patients, they really started to feel much pain. Their mobility is grossly reduced. They are back either to the wheelchair. Their sports activity is gone. So that is very young age. In that age is indicated to go for replacement surgery. So the reason to give this example is that there is no age limit. And person who is 60 years old or 70 years old, but he or she is fit. She has no diabetes, cardiovascular problems. Before this problem, this severe pain of the knee or hip, she could walk 2 or 3 hours. She could go for her shopping by herself. That is fit and healthy person. And for last, suppose 6 months, her mobility is reduced. She get tired. She get much pain in her legs, knees or hip while doing shopping. But she is actually fit and healthy. So 80 years old is indicated to go for joint replacement surgery. Another example to give is that there is no age limit for this replacement surgery. All we have to discuss with the doctors and patient and decide that this is the candidate to go for surgical intervention. This candidate will take benefit after replacement surgery. So there is no age limit for that. All depends on the indications. Some people, they say, she is even 60 years old, he or she patient, but she has diabetes and she has hypertension, so a lot of issues. I always say that these kind of problems, of course, they come with the age, more or less. Some people, they get this kind of sicknesses. But you have to discuss this in detail with your operating surgeon, with the orthopedic surgeon who is performing this replacement surgery. You have to discuss in detail with that. Diabetes mellitus or hypertension is one of the commonest disease in all over the world. So it's not a contraindication not to do surgical intervention for those patients. So you have to discuss in detail. Patients, the choice of patient, which will be a good candidate and which will be a patient who will get the much benefit after replacement surgery, that is the most important factor, which I suggest, or I'm sure a lot of orthopedic surgeons, they take care of this point. Well, for the viewers, it's very important that, as I said in the beginning, there is no age limit for joint replacement, either knee or hip. So if you have queries, if you have questions, you discuss with the operating surgeon. On display is my contact number. If you want to discuss further or you want to get appointment, you're most welcome. Thank you.